All right, here we go. Welcome to our August 2024 State TA Day. It's great to see everyone here. We don't have a full 2 hours on our agenda, so we thought that we would maybe just take a little bit of time at the end if anyone wanted to do just like a general Q&A. There are a lot of initiatives, a lot of new information happening at the department, and we just thought as long as we have, our team here and other resources here, that we could take some of that time to just do kind of like a CDC Q&A. If anyone has any lingering questions or needs to clear up something that maybe they aren't entirely clear about, we're happy to support with some of those questions. So, be thinking of those if you want to ask any questions at the end here today. We're going to kick off with Christy and Michelle, who are going to talk about our compensation pilots.
Hi, everybody. It's good to see all of you today. I was just talking with a colleague and said, didn't we just have State TA Day just like a couple of days ago? But it was a month ago. So I'm happy to be here with Michelle Stillwell-Pervinsky and to be talking to you about our CDEC compensation pilot programs. Charlie, should I share or can you guys, or do you need me to?
I can if you'd like.
Okay, that'd be great.
Sure. Oh, I need access.
Oh, you need access. Okay. Let me share it with you real quick. I'll share it with you directly. Okay. Did you get it, Ro? Ask.
There we go. Okay.
Thank you.
No problem.
Okay, we can go to the next slide. So for the past year, like a year ago, I think June of 2023, I shared with all of you about our family child care benefits pilot. And for the last year, I've been the grants manager of that program. I was able to use the research gathered as part of my master's thesis for my master's in social work. So that was really great. Great experience for me to be able to collect data and analyze it and write my thesis and graduate with my master's in social work. And now that is behind me, thank you. This program is transitioning to Michelle Stillwell-Pervinsky, and she will. Do you want to introduce yourself real quick, Michelle, and then I'll finish talking about this program?
Sure. Good afternoon. My name is Michelle Stillwell-Pervinsky, and I am the Early Childhood Workforce Compensation Administrator. I just started last Monday, but I know some of you from a previous role in the department. I served as the legislative liaison for 2 years, and then before that have been in early childhood for 15 years, mostly in California. But really excited to be in the program, on the program team, and working with the workforce division, and excited to work with all of you.
Thanks, Michelle. Next slide, Charlie. So who pre-qualified to be in the Family Child Care Home Benefits pilot? They were family child care home providers of all different license types, regular, 3 under 2, infant, toddler, experienced, and large, that have a rating of levels 3 through 5, and at least 50% of the children enrolled receive CCAP. So it's that combination of high quality and also high need. And of the approximately 50 providers that pre-qualified, 35 owners are currently participating, and those owners that have a large family home license have assistants. So we've got 25 assistants participating as well. Next slide. So we are excited that 12 counties have at least one family child care home owner participating in this pilot. And their base award is $3,300 annually for owners, and then assistants, their base award is $2,400 annually. So what that breaks down to is $275 a month for owners and $200 a month for assistants. Next slide. So Metrics IQ is our vendor. They send out the monthly payments to the owner, and then the owner makes sure that the assistant gets their payment as well. Next slide. So their award can be used in 3 different categories: healthcare, paid time off, and retirement. And over the first 9 months of the program, we saw healthcare increase 2% for medical insurance and 6% for dental insurance. Vision insurance went down, but that was because participants used their award to get new prescription eyeglasses, and then they used their award on paid time off for retirement. So they were able to take care of their vision needs and then move forward rather than using it towards vision on a monthly basis. And retirement increased by 6%. So of the types of insurance and types of benefits that they had at the beginning of the program to 9 months later, like I said, we saw increases across the board. And the largest increase of benefits was in the category of paid time off. So overall, 22% of participants use their award on healthcare, 18% on retirement, and then 60% use it on paid time off. So those are our initial findings. And then, like I said, this pilot is going to get moved over to Michelle. So next slide.
Great. Thank you, Christy. And I'm really excited about taking over management of this pilot, this benefits pilot that Christy has laid a great foundation for. And really, we're going to be including it in this new compensation work that's building off of a grant that you may have heard about, focused on innovative solutions to increase and improve compensation and benefits for the early childhood workforce across settings, across age groups. So we're really excited about this work that's going to build on a lot of what you all out in the field and the department has been working on over the past several years. And some of you may have heard about this grant, but I will just give a quick overview. And then if anybody wants more information, wants to kind of talk through it more, really would love to have you reach out and happy to have some conversations. So if we go to the next slide, we received a grant from the Early Educator Investment Collaborative, or EEIC. There's 3 different states or localities, so Washington, D.C., and then Colorado and Louisiana, who got grants to do really innovative work to transform early childhood workforce compensation, focused on innovation. Next slide. So what this is a 3-year capacity building grant, about $3.85 million, that's really focused on implementation towards long-term sustained increases in salaries and benefits. And we've done a lot of work that many of you have been involved in past years on our compensation task force, our benefit task force, to kind of lay out the vision. But now it's really like the implementation of how do we get the financing mechanisms in place? How do we do the interagency collaboration? How do we work with stakeholders to actually make this a reality so that we can have living wages and equitable compensation and benefits for our workforce? And then the only thing I'll note also on here is that we got this grant focused on transformative change. It can't be used for direct compensation for the EC workforce. So it really is figuring out what are those financing mechanisms so that we can have this in place permanently for our educators. Next slide. So in terms of what the grant is going to be paying for and building capacity for, there's some positions within CDEC. So that includes my role, which again just started last week as the compensation administrator, a budget analyst, and a program assistant. Amanda Roy, some of you may have met. And then if you go to the next slide, what's really exciting about this grant too is there's a real focus on interagency collaboration. And so we have some liaison positions funded at several other departments to really focus on building on the work that started to happen, but like having a person there that can really be thinking about how do we leverage the resources and the potential collaboration at other departments. So at the Department of Labor and Employment, looking at access to some of the workforce development funding, specifically for EC workforce that's really hasn't been utilized enough for EC, working with the Office of Economic Development and International Trade on how do we leverage some of the small business supports, working with the Department of Human Services on benefits utilization and looking at the benefit cliff and making sure that if we increase compensation, we're not having people lose benefits that are really crucial for them. And then a lot of the work with the Department of Higher Education on alignment around qualifications and training opportunities and pathways. So those are the funded positions, but we're also would be working closely with the Department of Education, Department of Healthcare, Policy and Finance, or HCPUF, and then the governor's office on this work. And sorry, that was the next slide, but just I was listing what some of those liaison positions were. And then if we go one more slide forward, the last piece of this that we know is so crucial is really how we engage with the variety of stakeholders, so both all of the early childhood councils, and then a level down of our educators, our providers, and advocates. So next, if we go to the next slide, we will be working on developing kind of a stakeholder advisory group within ECLC and developing some working groups to focus on, again, that implementation, how we take the vision that we've had a lot of input from stakeholders and all of the leaders in the field. How do we take that to implementation? So that's something that we will be, hoping to get set up in the next few months. And if people are interested in being engaged in any of those working groups or on a, less time intensive way, please feel free to reach out. And so if we go maybe forward 2 slides to research and policy, the last thing that we're really going to be focused on is looking at what is the cost modeling, the planning, the research that needs to be done, and the policy development to support all of this work. And that includes building on the pilot of the Family Child Care Home Benefits pilot that Christy was just mentioning, as well as the early childhood teacher salary pilot that we've been running for the past several years as well, and thinking about, okay, how do we take those pilots, they're only for a small group of people, and make it into a sustainable statewide program. So that's just a very quick overview, and I probably still went over, but really excited about this work and wanted you to have a quick overview. And again, if anybody is interested in learning more, diving in, has thoughts, want to share what's going on in your local area or where you think there might be opportunities that we can support you with, please reach out. And I'm sure I'll be connecting with many of you in the coming months and years. So thank you very much. Are there any questions for Christy or for me right now before we head to the next item of the agenda? Okay, great. Then I will hand it back over to Christy.
Thanks, Michelle. Charlie, if we can go to the E&E slideshow, that would be great. Slideshow, it's a show. E&E, all things E&E. last month, I introduced myself as your interim E&E grant manager, and this month I'm introducing myself as your E&E grant manager. So glad to be serving you in this capacity. And Charlie, if you can run the slide deck, I'd love that. Thank you. And we can go to the next slide. So I've got some updates for you in regards to E&E and the sugar to Salesforce transition conversion. We've used both words, but on August 29th, we do plan to transition the sugar data to Salesforce. So we've got a date for that. So that is very exciting. And once the conversion is complete, MOUs will go out for any applications that have been made eligible since July. Danielle and I have started notifying councils of those applications with just a note letting you know which application has been determined to be eligible, and that we're going to hold on to those funds for that application, and that you'll get the MOU when we're ready for that step. And we are so close. We have less than 30 applications that we're working to get across the finish line. So Danielle and I are reaching out and with lots of emails, and so we just appreciate your responsiveness with that. Speaking of reaching out, you will be hearing from us, the councils that don't have any active E&E grants. We're going to be contacting you about closing out that E&E contract. We will not be pulling back any funding that has already been spent. So I want you to know that as well, but you'll hear from us about closing out your E&E contract if you don't have any active E&E applications or grants at this time. Next slide. So we've got the links to office hours, and just know that you're always welcome to come to office hours. I will be reaching out to schedule one-on-ones to ensure that you're getting the support and the encouragement that you need to get these applications across the finish line. So we're in this together. It's a group effort. Everybody is needed, and we can do this. We're gonna get to the end of E&E. We are. I know it. Next slide. So if you need to request any transfer of funds, this slide that you'll have access to has the link to the form to fill out to transfer those funds. And then if there's an application that we haven't reached out to you about, you can add it to the ready to review, and Danielle and I will get right back to you. Okay, next slide. Any E&E specific questions at this time? And if not, like Charlie said, we're going to have our Q&A at the end of this meeting. Okay, thanks for your time.
Thank you, Christy. We're super excited to have you on as manager. We know you have big shoes to fill with Emily, having to leave to take care of her family, and we honor and respect the work she's done. We're also very excited to have you stepping up into this role. So thank you. Cool. All right. Let's see. Next up, we have Jen McDonald, who's going to talk to us about first aid and CPR vendor approvals.
Thanks. So this update should be pretty quick. Let me share my slide deck. As many of you know, the Department of Early Childhood approves trainers for lots of different courses. And so we're looking forward to do some process improvements over the next year. And I just kind of wanted to introduce to everyone for awareness what our plan is and where we're starting. So we'll talk about where we are, what's changing, how we're going to support the change, and then our timeline for communication. Current state, as I said, many of you know, we approve trainers currently for first aid and CPR, standard precautions, our pre-licensing training for family childcare homes, med admin. We actually do have trainers for safe sleep out there, and of course, our EQIT course as well. As you may or may not know, the application process and the approval process for all of these different trainings is very different. It's managed in many different ways, and some of the trainers for these courses are added to our approved training vendor list, which has been around for it's been around for as long as I've been with was in office and now a department. So at least 8 years, 10 years probably, and maybe even longer than that. So we are looking at transitioning to a more updated approved vendor list. So just as a high level, these are some of the different trainings or courses where we approve trainers for. And as you can see, they all have a different kind of application process where trainers can find how to be approved for these different trainings. And many of the trainers for these courses are actually the same person. So they oftentimes have to go to many different places to figure out how to become approved to teach all these different courses. So we're hoping to transition to one common place where trainers can go to find information. So we're starting with first aid and CPR. So because that's one of our most antiquated trainer approval processes. Currently, folks apply by filling out a PDF form and submitting it to an email. And so that one we're starting next month. There will be an application in the PDIS for first aid, CPR, and wilderness first aid trainers. Where professionals can go in and apply directly in our PDIS. It will be a very simple application, just a couple of questions. The questions are all the same ones they currently have to fill out and complete in our PDF application. And trainers will be able to see the status of their application in the PDIS, and also licensing will have insight on the back end to all the approval processes. They will now appear on a new and updated approved vendor list, the first phase. So over the next year, we will be phasing out the current antiquated approved vendor list and transitioning to this new list. So for a period of time, there will be two lists that will cross-reference each other. And starting next month, the folks who will appear on that new list will be trainers who apply just for first aid, CPR, and wilderness first aid over the next year, and we'll be rolling out similar applications for the other trainings that we approve over the next year, and more information will come over the next couple of months about what that will look like. Our goal is to have a more user-friendly, accessible, accurate, searchable list that is actually a real resource for programs. So the new application, as I mentioned, we're hoping it will be easy to complete. Really, it's just a couple of questions. Both the trainer and folks here at CDEC will be able to track the status of the application. It will all be in Salesforce, hopefully very transparent. Trainers can also select with the new list if they want their contact information published to the list. We have some trainers who only teach first aid and CPR, for example, for one particular program, and they don't want their contact information published for other people to contact them. Currently, we have one list that's viewable to all. And so with the new list, we'll be able to have a public-facing version, but also licensing will still be able to see approval statuses for folks who don't want their names on the public list. So that's something trainers have been asking for quite a long time. Just for awareness, I don't know if everybody knows why we actually approve first aid and CPR trainers. This is not training material that we at the department have created. It's run through different agencies, one American Heart, for example. The reason that we do this is because there is a CCDF requirement that everybody in licensed programs receives pediatric first aid and pediatric CPR training. So one of the ways that we make sure that our particular trainers are offering the training via the requirements that are set out for us is through this training attestation. This is one of the processes that CPR and first aid trainers go through when they apply. They sign this attestation. Again, currently that's through our PDF form, but it will be in the application going forward. So I get this question a lot, which is why we approve these trainers in the first place. The new list, as I mentioned, it will be embedded in the PDIS. Professionals do not have to log in to be able to see the list and search the list. It will be searchable by trainer's name, the training that they're offering. Currently, we're starting out with just CPR first aid and wilderness first aid, but eventually we'll be adding the other trainers. You'll be able to search for the languages that you need, the county that you'd like your training taught in, if it's an in-person training, the course delivery method, for example, is it in-person, hybrid, or virtual? So hopefully this list will be much more user-friendly and actually useful to professionals. So it's a small change, but we are trying to since it's been one of these processes that's been around for at least a decade, we're trying to over communicate because probably over this time, there's been a lot of information out there about the old process. So one way that we're doing that is all currently approved first aid CPR and wilderness first aid trainers will get a 90-day extension on their approval in the old list to transition folks to the new application process. We will be creating how-to guides. We'll be offering help sessions. We're trying to over-communicate to professionals and just the public and people who might be trying to find an approved trainer about the change and where to find folks. So the information went out yesterday in PD's newsletter from the PDIS. I'm here today. We're communicating internally with licensing, training our licensing specialists on how to find professionals on the back end of the system. We're also sending out multiple emails to trainers who are currently approved about the new process. And then next month, those how-to guides and help sessions will be hosted along with more emails to our current trainers. Again, we're trying to over-communicate. It is hopefully a small change, but we're hoping it will be not very disruptive to professionals. And that's really it. So this is just awareness so everybody knows. But does anybody have any questions? Okay. Thank you very much. I appreciate you guys listening to me today. And as I said, more information will be coming out. So that's all I have, Charlie.
Thanks, Jen. Thank you so much. If you don't mind chatting me over the PowerPoint, I'll make sure it goes into our agenda. All right. Next, we have Eva and Leah, who are going to talk to us about EQIT.
All right. Thanks, Charlie.
Hmm?
I will present. Let's see here. Okay. Well, it's good to see everybody and hear from all of the different groups as always. It's always good to hear all this information. So thanks for taking some time to also hear about some EQ updates. I wanted to let folks know, and most of you who are council leads probably have already seen the agenda, but I'll be hosting a breakout session at the next face-to-face ECLA meeting in September. So I'm excited to get to see some of you guys in person and chat with you about what might be on your mind. If you have things that are kind of bubbling up right now for you, or just kind of seem to be something that you'd like to circle around with a larger group, if you wouldn't mind sending me thoughts and ideas or feedback, I'm thinking about agenda items right now, and would just love to hear any of your thoughts that you'd like to talk about together that day on September 20th. We did talk about this last month, but this year we are introducing our Smart Sheet invoice tracker. which is a process that I've been using at least for 1 year. And this year we wanted to invite councils in on that process so that we were sort of all on the same page, seeing the same things, seeing the same numbers, so that we could catch any mishaps that might be happening throughout the year. So if you haven't received that email to access your Smartsheet tracker, let me know. You may have received that email, which would have been about a month ago, sometime middle of July, from Jen White. Otherwise, I'm happy to send you another invite. If you haven't seen that yet, or you can't find that, or you don't think that you're added, it's really easy just to send a new invite for that. So I just wanted to circle back around to that and let folks know that that is happening. And we're already in August, so we're in process now. I've got it just kind of collecting some end of the year data points for EQ that I wanted to share out with the group. I know that this is kind of a lot of data on one slide. I considered making a couple of slides, but then I just kind of left it all on one. I will be creating a report based off of some of this, along with other data that I'm still kind of gathering up, but just wanted to share out a few numbers that I thought were interesting with the group today. So the number of coaching hours that of EQ related and EQ focused coaching hours, which includes Lena, Grow, and Find, and EQ coaching across the state were 1,481 out of 2,000 hours that were initially considered. So that's exciting. Lots of coaching going on out there. The number of EQ course completions over this last year was 810. So that means that 810 infant toddler providers, family child care providers, FFN providers, center providers, and more completed the course. That number has kind of maintained over the last few years. So we've been seeing it hovering around 800. It was closer to 1,000, and then we kind of around 2020 bumped down to around 800. So just kind of watching that number, but staying on course right now for in comparison to the last few years. The number of total courses that we ran across the state last year were 45. So 45 EQIT courses ran. We had 5 Spanish courses run, and we had 3 Arabic courses run this year. That was our first kind of go round of having Arabic courses after we did a big lift of doing translation work, thanks to some of the folks who are on this call today. So that's exciting news. The number of individuals who are interested in taking EQ for credit. So this was a new question that we kind of added into the registration process. So out of that 810, 300 indicated that they would be interested in taking EQ for credit. So we've been working with the community college group over this last year to develop a credit for prior learning course shell. So that's kind of in process right now. So it's an interesting data point to know that lots of people are in fact interested in taking EQ for credit, and will likely be revisiting that over the next year. Number of infant and toddler caregivers total in the workforce are 6,295. So almost 6,300 people indicate that they're infant and toddler caregivers, according to PDIS, according to what we have in PDIS. The number of councils who are engaged in EQ work are 25 out of the 36. Our trainers, so that ITST are the people who have their infant toddler specialist trainer credential. So we have about 92 certified trainers who are teaching those 45 courses. We have the ITSC, which is the infant toddler specialist coach credential. We have about 44. We're working on moving that number up right now. People are kind of working on getting their certifications. But those are those are current numbers. The number of Spanish instructors that we have certified are 5, and the number of Arabic instructors we have certified are 5. So thank you to those 5 incredible humans who are doing this heavy lift across the state. We really hope to continue to address that. Yes, thank you, Christina Herman, being one of those people. We hope to continue to address increasing that with some of the work that we're hoping that will happen over this next year. So we'll keep talking more about that, but that is something that's definitely on the EQ Initiative's radar in terms of helping to support Spanish and Arabic. Those are the 2 languages that we have the EQ materials translated into. So that's why those are kind of the 2 focus points right now, but we are always thinking about what would be the next step, but we have to take baby steps, of course. And then how many infant and toddler specialists have been trained over the last year? So total people who have ever gone through our Infant Toddler Specialist Foundations course is 400. So we have 400 people out there. So if anybody ever wants to come on, yeah, babies, that wasn't, but hey, there you go, Charlie. Pun intended. Yeah, so we've trained lots of people. Some people stay current and keep active. That's why we're continuously offering the Infant Toddler Specialist Foundations course. And I think that is all my data points that I have to share with you today. So just wanted to kind of give you some of that information. If any of you out there would like to use any of these bits and pieces for your councils, for newsletter items, reports that you're working on, definitely let me know. I'm happy to share things. And like I mentioned, I'll be working on a more official report that I'll be sending out. Oh, Angie says, when's the next foundations course? So I think I will let Leah talk a little bit about that.
Absolutely. Thanks for asking, Angie. We are really ramping things up, and it is our goal to offer both the foundations course and our coaching with the EQ Relate courses that train the infant toddler specialist trainers and the infant toddler specialist coaches every year. So we are gearing up to have the next foundations course be in the spring. And we already have an interest form that is prepared. And so if you have people who are reaching out to your councils, I had several emails this week, but they're like, but how do I connect with my council? They will be reaching out to you because that's what I tell them to do. And you can absolutely pass along the form. If they reach out to Eva or I, they also get the form so that we can start tracking the interest. It is our goal. I mean, this last foundations course that we had was phenomenal. We had 31 people go through and everybody completed the actual course. I am still waiting on a handful of people to partner with who need to do their final interview and be certified. So the numbers Eva shared with you will be even higher. And I think that's super exciting, especially for our facilitators who speak in additional languages. So we'll update that as soon as we can. But we do hope that by offering things on a more regular basis, we might have cohorts that are a little bit smaller, but mightier. And so we can really build those connections and support them through their training and then their facilitation. And we're excited to have so many people who are sticking around and staying. And with this last cohort, we just added to the number of active facilitators, looking at the 400 who have learned how to do the EQ work in the past 20, 25 years. And we're hoping to just keep building on that momentum. As far as PDIS courses go, we are doing fantastic. We have 26 courses active and up in PDIS right now, and that's just for this fall. So if we look at our numbers, if we continue with this, we're going to offer probably close to 50 by the time we get to the spring and get everybody in. It has been amazing. We've had some wonderful levels of enrollment. And as far as I can tell so far, those numbers are staying very high. We do know there's a couple councils out there who haven't met with me yet. The new process this year is that in order to get your course going in PDIS, you first need to make sure that all of your instructors listed on your course plan have met all the requirements. and they can reach out to me if they have any questions about what those requirements are. Then the council administrator, whoever has always put the course into PDIS in the past, needs to schedule a time to meet with me, and Eva and I will coordinate to make sure that everything you've done on the budget end is ready and good to go. And then yes, I can meet with you and help you put your course into PDIS. Even though I know you guys are all trained professionals, this is a really good touch point for us, and it has been wonderful to connect with so many councils. So we really appreciate your leaning into this, because it has been a great way for us to make sure we're keeping on our pulse on what's happening at the council level. So yes, that's still going to be the policy, even as we are looking forward to adding winter and spring courses. Everyone will still need to reach out to me. The other thing we wanted to share is that we are going to create some additional offerings. Can you switch our slides, please, Eva? To your infant toddler specialists. With the revision of our curriculum, which we're now, gosh, it feels like it's been a long time. I think technically we're at a year of using the revised materials. We're still finding, especially with our instructors who have been in the EQ initiative for a long time, that we have a lot of questions and wonderings about how do we do this. So we are going to be starting an additional offering once a month of curriculum focused office hours, where we will focus on one module at a time. There will be some modeling of what the learning experiences look like. There will be times for questions and answers, and for us to just collaborate together as an infant toddler specialist network. We will make recordings of this so that our specialists who can't make it to office hours, because that is the biggest challenge, is finding a time when everyone can meet, they can still access them. And because we know this is above and beyond their infant toddler specialist work within your budget, we also will be offering PD hours through PDIS, so that we can make sure we're honoring this time and energy that people are putting in to being knowledgeable and familiar with the material. We really want to honor that professionalism. So yes, if anybody has questions about that, they can reach out to me. But that's all I had for you today. But I wasn't watching the chat. Either the things in the chat I should answer, or did you handle them all?
Nope, I think we're good. We're just talking a little bit about some
Oh,
of the
the
data
reports.
points. Yeah.
Mhm,
Yeah.
mhm.
Yeah. I'll
Yeah,
chat
and
with
I
you,
think
Stacy.
I'm going to add to that, Stacy, and one of the things we talked about, it would be really helpful for us as we're looking at the report building to know what specific information you as councils are looking for on the report. Because then hopefully we can build it in a way to meet your needs. And hopefully that's similar across councils, so we can pull one report and give each council their own.
Okay, thank you. I think we are
You
set.
Thanks.
awesome. Thank you both so much. We're very excited about how EQIT is growing and becoming more accessible to providers and kiddos across the state who really need it. So we appreciate the initiative and lighting that fire and getting that going. All right, we have SSBI updates.
Hi, Charlie. Hi, everyone. I'm going to go ahead and share screen. My name is Kristen Lang. I am the State Systems Building Initiatives Manager for our department. So good to see you all today. I'm here with my colleague, Megan LeClaire. Megan, do you want to introduce yourself real fast?
Hey all, my name is Megan LeClaire. I'm the Preschool Development Grant Birth Through 5 Administrator at CDEC on Kristen's team.
Awesome. Okay, and just a fair warning to you all that we've got too much content to cover in the 10 minutes that we have. And so we will send this deck to Charlie. I will do my best to hit some highlights, and certainly anytime that you have questions, you can reach out to me or Megan and we will get back to you. So,
Kristen, don't we have some extra time today, so
okay, all right, perfect.
don't stress. Okay.
Okay, all right. So wanted to share a few updates on the PDG or Preschool Development Grant Birth Through 5. For our current planning grant, as many of you know, we've been talking to you for months now, actually, since winter, early spring, about this idea that we had to travel across the state to really make sure that our new statewide early childhood needs assessment, our new statewide early childhood strategic plan could be meaningfully used by communities across the state, as in particular, the strategic plan really belongs to everyone in the system, and we wanted to design a way for folks to engage with that plan in a way that advances their local early childhood system. And so those plans have solidified over the last couple of months. Unfortunately, we're not able to go everywhere in this first round of visits. So we've scheduled the following meetings that you see here. What you're seeing here in terms of dates are when we will be traveling out to these communities for in-person engagements. The way that we've set these up for most communities is that there's a first virtual portion around the needs assessment and then an in-person around the strategic plan, but that's varied by community depending on what works best for them. So Megan, Michelle Snively Gonzalez, and I were hanging out with Michelle and Carrie and Sterling on Monday and had an incredible event with folks from Logan, Phillips, Sedgwick, and Morgan counties. And so just wanted to let you all know where we're going in this first iteration and repeat that we are hopeful that we will have more funding to do more of these trips in the years to come, because this strategic plan is big and bold and relevant for many more years. And so just wanted to provide that update. For those of you who may be interested in doing something locally or just needed to be reminded about where you can find, in particular, materials related to our statewide early childhood strategic plan, I wanted to share that the website has been updated. And so there is now a ECLC website that has all the materials you could ever want about the strategic plan available to you, the resources in English and Spanish, newsletter and email content, as well as training materials if you want to run your own presentation, and action planning worksheets. So wanted to make sure to elevate that resource to you. That's linked here in the presentation, which again, we'll share with Charlie. And then also, many of you previously asked for some printed copies of the at-a-glance version of the strategic plan. I wanted to assure you that those are coming within the next month. We just needed to take some time to get the print order all together. And so, Megan, if you are able to drop a link in the chat to that, that would be great. For whatever reason, my view is such that I can't find the chat right now. So that would be wonderful. So if you didn't put in a print request previously and you're interested in copies, hard copies of the at-a-glance version of the strategic plan, you can go ahead and add your information to this form. We're going to do our best to fulfill those requests and mail them out to you. So next, wanted to just give you a quick update on another topic I've been talking to you about for months, which is our state's new opportunity to apply for a PDG B5 renewal grant. We got through all of our steps and submitted our application at the end of July. It was so exciting. I'm incredibly proud of the application. It reflects all of the strategies stemmed from the statewide early childhood strategic plan. They were all developed with partner input, with Family Voice Council input. So, you know, we really responded to the feedback we heard from the prior iterations of PDG that folks wanted to be involved, including you all from the very beginning of strategy conception. And we achieved that. And I think we have a very strong application. We will hear back in mid-September. If we are awarded, that funding will begin September 30th of 2024. And again, we were eligible to apply for up to $8 million per year as a state. We just about hit $8 million. It was like $799,000 and like some additional hundreds. So But, you know, even if we are awarded, they may come back and say, hey, you have to reduce your budget. So we'll see, but we'll keep you posted as we learn more about whether or not our state receives funding. This is a part where I for sure will not have enough time to go through, but I wanted to give you at minimum a high-level overview of the strategies that were ultimately included in the application. There were 21 of those strategies, along with the requirement we have of needing to evaluate whether the grant's successful. So when you see PPEP, it's just the evaluation of the grant work itself. Those strategies, as I mentioned, you know, were responsive to our needs assessment, came from our strategic plan as a state, and responded to our PDGB 5 theory of change, which is specific to the outcomes we want this grant to achieve. We thought about the best way to maximize the budget and staff capacity, wanted to make sure we had a good balance of activities across the different categories that the grant sets out. We aligned with the CDEC's goals, the Family Voice Council priorities, our state plan, prior PDG work, and also thought about places where we could make sure we could mix between putting funding directly into communities and then developing sort of state level resources and plans, and also wanted to ensure a strong connection to the Colorado Department of Public Health and Environment, their work, because they were key partners in us being able to write this grant, and obviously are a key partner for all of our work. So here, I'm going to get into the part where I won't have enough time. So let me frame this for you for when you go back and take a closer look. Any of the strategies that are highlighted in green are those that the Family Voice Council prioritized for inclusion in the application. And then the way that they're organized is according to the activities that the grant itself sets out. So I'm just going to this is going to be lightning round. So we have work in here that's around continuing to implement our statewide early childhood strategic plan, utilizing a collective impact model and being able to fund a backbone organization to support that and additional engagement with communities across the state. Under maximizing family engagement and participation, we have some work looking into deeper research and action plans around infant and toddler subsidies in our state, as well as weekend and off-hours care. There's work here to support the implementation of the new CCAP rules. This looks like a low amount. That's to support some facilitation, but the grant also supports a staff member to help with the implementation of those new rules. Continuing to build on the leadership skills and great work of the Family Voice Council, as well as our new Tribal Advisory Council and the work that Sina Harjo in our department is doing to promote tribal relations in early childhood. One of the things she proposed here that I think is really cool is the idea of putting on a children's powwow. There is work here that really thinks about streamlining and strengthening the ways that at the state level and with partners we communicate with families, and how we can create a statewide common plan to do that strategically over the course of the life of a child. Work here on thinking about looking at all the different subsidies that support families in our state, how we can align the eligibility criteria for those in places where we have control over that eligibility criteria, supporting further development of the common application. And then the whole person health and well-being convening and mini grants. If any of you participated in the infant and toddler mini grant opportunity this last time, or were part of the PDG planning mini grants prior, this is the same concept. It's just taking the lens of whole person health and well-being and the strategies in the strategic plan related to that. We're going to be looking from a workforce perspective at supporting quality nutrition and wellness for our early childhood professionals, at continuing to strengthen the statewide career pathways and competency systems, and developing a training of special recognition for preschool teachers. We have included funding for more minor quality improvement grants for childcare providers that you all help and manage to get out the door. And so again, this is a 3-year budget, so this would be over the course of the 3 years. Looking at developing more exclusionary discipline and family engagement curricula, and then building on all the great work you just heard Eva and Leah talk about with being able to strengthen the ability to offer EQIT in Spanish and Arabic by promoting or being able to support more coaches to be able to offer the training, as well as to translate the train the trainer. Also, thinking about expanding use of that find coaching model that was piloted and proved successful in our state. The application also includes strategies around developing that universal preschool program resource bank and advancing the early childhood integrated data system some of you might have heard about on the ECLC this morning. We had an opportunity to do sub-awards or sub-grants this time, and we had 2 concepts here. One was leveraging the Family Child Care Home Network contracts to pilot additional subsidy for infants and toddlers who are eligible for CCAP, and another around being able to pilot Thrive by 3, which used to be called Early Start, but was developed a couple years ago. Many of you were involved in creating a program model for how we can serve children who do not qualify for Part C early intervention services, but we know need additional support. And then a couple bonus options. We did both of them. One was to think about a benefits pilot or access pilot for early care and education professionals. So how can we support folks in becoming health insurance navigators and them helping our early childhood professionals to access more affordable health care, as well as receive subsidies for health care. And then another bonus option was around the infant early childhood mental health work that's been happening in our state, continuing the work of the advisory and their priorities, as well as strengthening that statewide brief consultation model that was lifted in the last couple of years and doing additional systems building work. And then the PPEP, the evaluation part. So lots of really exciting things in the application. We are so hopeful and feel really confident about the strength of it. And so hope to be coming back to you in September, October with some really great news that Colorado continues to be able to innovate in these great ways that PDG has supported for the last several years. So I will jump off. If you have any questions, I've got to run to another meeting. Please send me an email and I will pass it over to Megan.
I can present, Kristen, if you gotta go.
Awesome. Thank you.
Hi, everyone. My update is super quick. Just a check-in on shared measures. So as you all know, the data collection was due on the 15th of this month. As of today, there are 32 out of 35 councils that have submitted their reports. So that is such an exciting metric to look at. So huge thank you to everyone that worked so hard on getting their reports in. I know this is the time of year where there's lots being asked of you for reporting. So we're doing our best each year to refine how we ask you all to collect data and try to align reporting as much as possible. So thanks for bearing with us as we learn what works and what doesn't work each year. There's just a little timeline on the slide to show that now begins our data analysis period. So I'll be working with our data team at CDEC and likely Megan Lockteff to do some qualitative data analysis. But I just wanted to reiterate that this is such a great tool and we're so excited to get the dashboard refined as well each year because it's also a good resource for you all. And so yeah, we are, if you are one of the 3 councils that is not reflected in the 32, you already know, I've already been talking to you. And so we're getting closer and closer to getting that 100% completion rate. There are, oh, and I want to do one last thank you for joining the drop-in office hour sessions that I hosted over the course of the past 6 weeks. I learned so much from you all about some intricacies and nuances that come up when you're digging into the different reports. And so I'm going to be working with the data team to see if there's anything we can do on the back end to kind of fix some of the issues that we ran into this year. So thank you again so much for just your active participation. And the next slide just shows our email addresses. So if you have a question for either me or Kristen, please don't hesitate to reach out. And thanks so much for your time. Carly, I'll email you the slides right now.
Cool. Thank you so much, Megan. All right. So we just have a couple reminders to shout out for QRIS. As Megan said, the annual report was due on the 15th. I know most of us have turned it in, but if you haven't, I know a few folks need some slight extensions. So just make sure you're communicating with us about that and get those in as soon as possible. The deadline to fill out your intent for a minor improvement grant, your interest form, is at the end of the month on the 31st. And we'll hopefully have a decision made by the 15th of September on whether or not we have enough funding for the specific application to move forward. And Lilith is going to be sending out an explanation of fields email that kind of goes through the different fields in the sugar system. We had some issues with reconciliation. We have an update going into the system tonight, and by tomorrow, fingers crossed, we should be able to reconcile the current spending that's in QIM. Did I say something else? We should be able to reconcile the spend. Oh, I said sugar. We should be able to reconcile the spending that's currently in Salesforce by tomorrow. So just hold tight. Diane, what's going on?
I just have a quick question.
Yeah.
I'm a little bit confused on the minor improvement grants. The Google form, I had sent that to the people who were interested in getting the grant and having them fill it out. But are you
Yes.
wanting those to come from us?
No, they can come from the providers. No
Okay,
problem.
so if the providers already sent them in, and they've
Then-
sent me the backup document, so I have it.
Yep.
But if they've sent it in already, then I don't have to worry about it.
Yep. Then it's good. Yep. And so our timeline is within that first week of September. Lilith and Michelle and I, probably some other folks from my team, are going to pull the applications for our councils that we work with, and kind of do an initial screening and make sure that they're all, that they're all appropriate for the grant. And then if we still need to do some more screening, then we do have we created what's it called, like a form where we can, rank based on need and everything like that.
So we don't have to put something in EC Connect or anything like that.
No, not right now. So
Okay.
what will happen is we will announce which programs we are awarding, and at that point, they'll need to go into Salesforce and fill out the minor improvement application in
Okay.
the system. So yeah, by the 15th, you'll know which programs need to do that, and we'll be able to send you some instructions on how they can fill out those grants in the system. So yeah, that was something I wanted to discuss anyway, so I'm glad you asked. Very guided questions. Help me through that. Not a paid actor. Okay, cool. So I think we're just going to open things up to a general question and answer session since we have some extra time here at the end. We have a lot of our professionals on this call. Maybe there's some groupthink we can come up with to answer any questions, but yeah, I know the QIM has, I know it's been a rocky launch, but we've got it up in the air and it is flying. So I appreciate everyone's patience as we've gotten that off the ground and, have worked through some issues that have popped up and are continuing to do so. But we sincerely appreciate everyone's patience. Oh, there is, Michelle, are you on? I feel like,
Yes, I'm here.
do you mind talking about indirect a little bit? Sorry to put you on the spot.
Oh, not a problem. Not a problem. Hi, everybody. So we are still working through readjusting and looking at indirect indirect amounts that to make sure that everyone has funding in their accounts to cover indirect when we pull it, which I believe will be tonight during the hot fix. So we're still reaching out to some of you because we are readjusting some funding. This has been, I know this has been a difficult time just because we've all been on our toes about the funding anyway, and now we've got this issue coming up. So we appreciate everyone cooperating and helping us out with just getting everything readjusted. Lilith, do you have some more to add? Lilith?
I know she's had some internet issues, so.
Yeah. So
She put it in the chat that she'll send out a chatter when we're good to pull reconciliation reports and directions. So wait until you see that chatter to do it. Should be tomorrow morning, if all goes well tonight, which our syncs have been pretty successful, I would say 80% of the time. So I'm putting good vibes out there.
we're focusing on the 80% and not the 20%. So
Yes. Yep.
So I guess, does anyone have any questions then about the indirect? I know we are working with some councils individually to make sure that everything is good to go for tonight. So if you haven't heard from us, it's probably no good. No news is good news. But please watch your accounts tomorrow or check your funding streams, and you will see those adjustments in your funding streams of that 10% being reduced of what you've already allocated out for applications. And then continuing forward, if everything goes well tomorrow morning, then all applications that are then processed will have that 10% indirect automatically deducted from the funding stream. So that is the goal for tomorrow morning. So make sure you are looking at your funding streams and paying attention to the amounts you have allocated and making sure that it also includes 10% indirect. That's the thing. So if you're wanting to look at it today, just to make sure that you're good, look at your funding streams. You want to look at the total, you want to look at your allocated funds on your funding stream, and then you want to look at the remaining balance and make sure that that is at least 10% of what the allocated funds amount shows. So that's what you want to look for, just to make sure that your funding streams are looking good for this fix that is happening tonight, or readjustment, so that we can now have the indirect automatically deducted from the funding stream with the applications. All right, I think that's it, Charlie.
No other questions? Anyone else? I know you guys are probably sick of hearing from us. I
You're sick
get
of
it.
hearing from us too, so it's all good, guys.
Okay. Cool. Well, I also understand that everyone's busy, and to have this time back is a true gift. I hope you all take at least 10 or 15 minutes to enjoy the sun or get outside or do some self-care for yourself. You all deserve it. And you have this event on your calendar, so everyone will think you're still here. So cool. Well, thank you all so much. Let us know if you have issues. We're here to support, and we're looking forward to our next state TA Day in September. Have a great rest of the summer. Great to see you all. See you again soon.